Our research shows coronavirus is sensitive to heat and sunlight, and yet the virus is surging in the summer heat of Arizona, Texas, and Florida. How can that be? What is it that's different about us and hot weather states in general that would trigger a heat-sensitive virus in the hottest time of the year? And why is it now disproportionately striking young adults? Well, the data is now giving us some interesting insight that is not leading in the direction that many of you may think.
Black Lives Matter!
For example, many of you are convinced those mass protests triggered the surge in cases. We've received a number of messages asking why we will not attribute the spike in infections to the protest, and complaints calling me all kinds of stuff for not blaming the protesters for the COVID spike. But the research and the data indicate that the COVID spike in Florida was not caused by the protesters. Did you notice some of the largest protests played out in George Floyd's state of Minnesota, where the COVID positivity rate stayed low and steady? And in places like Philadelphia and New York, and communities and states where infection rates have since declined in the days and weeks following the protests. This National Bureau of Economic Research study actually found the protests discouraged many other people from going out to places that could have spread the virus, effectively offsetting the risk of increased transmission within the protest crowds. While the research notes it's possible the protests could have caused an increase of spread among some who attended, it determined that that had little effect on the spread of the pandemic across the nation. And here in Florida, Governor DeSantis has repeatedly dismissed the notion that the protests fueled the current spike in cases and infection rates that we're seeing. His health experts can find no evidence to support it.
I certainly have not had my Department of Health substantiate that the protests are driving the figures with the younger people.
The state does extensive contact tracing to figure out where people who tested positive have been before they get sick. And the health experts in our state are finding a clear pattern here. And it is not leading back to the outdoor protest. Instead, it is leading to indoor places where young adults go to hang out and party.
The sick individuals have all stated that they've been around a pub, a bar, an event.
The state says the Knights Pub in the Orlando area is just one example. State agents say it violated social distancing orders. Then, more than 40 customers and staff tested positive before the state suspended its alcohol license.
And you pack huge numbers of people indoors that are very close, you're creating an environment that you're going to see more spread.
Same goes for Arizona. Bars in that state opened a couple of weeks before they did in Florida. And its surge started a couple of weeks before ours did. Video from Arizona shows young adults packing the nightlife districts just before the virus exploded among young adults.
Younger people, I do think, have a sense of invincibility, many of them, because it's the truth. They are at lower risk for getting complications themselves, but they're at an elevated risk for spreading it to others.
They're at risk of spreading it to others, including parents and grandparents and older coworkers, those with underlying conditions, people they don't even know at the grocery store, which could trigger a surge in hospitalizations and fatalities yet to come.
You have an individual responsibility to yourself, but you have a societal responsibility.
That's why Florida suspended the consumption of alcohol at bars on Friday to try to stop young adults from crowding indoors together and spreading the virus. Of course, people can still take undue risk and continue to spread it elsewhere.
I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you.
So the evidence is clearly leading to young people going out to party. But again, why is it disproportionately slamming the hot weather states when the virus is sensitive to heat? Well, keep in mind, it's not just the virus that's sensitive to heat. People are too. And so in the hottest states in the nation, people may tend to gravitate more indoors in the cool air conditioning where the virus can also thrive. And one more cautionary note here. As for the other states like New York that have seen their rates go down, consider that they have been closed much longer than we have. To our north, people are just beginning to go back out as people in our state did weeks ago. Infection rates could start spreading there yet again and continue to spread all across the nation if more people don't heed the call to avoid large crowds, to follow local orders, to keep your distance, and wear facial coverings when you can't.